Hello everybody, Sheriff Küçük here. I am oral surgeon and the founder of Bone Factory. How become you a biological bone builders? Welcome to the video. We want to talk about how can you reconstruct the bone predictable and safe. I'm going to show how we create the bone with autogenous bone. In this case, we have a lateral defect in the ratio 3.6, and our predictable technique here is a biologic bone augmentation concept. And for this technique we use the microsaw. Microsaw is a special instrument to create a bone block in the retromolar area from the linea obliqua externa. And as a special instruments we can make fine lines to create a bone block. And with special instruments, with a special drill, you can make crystal perforation to create a line 3 millimeters from border, and then we have enough block bone distance and block bone thickness, and with the chisel we can produce a fracture line to get better the bone outside from the mandible. The sharp eggs we use for the sharpening the safe scraper, and we can make smooth the sharp eggs. And by the way, we can win particulate bone. The bone in this quality is too thick for our technique, and this is the reason because now that we are make a split technique. We are splitting the bone in two pieces. With the microsaw handpiece strike, we are create a circular linear of incision. Then for the bridge in the middle of the two blocks we use a big disc, and now we have two blocks in same size, and this block is too thick again for us, and with the safe scraper we can reduce the thickness and win in the same time particulate bone for the augmentation procedure. And during the thinning we can smooth the sharp eggs again, and this is a bone which we can win from the linea obliqua externa for one implant. And in this case we want to insert implants from the company Nucleoss from Turkey, and we are using the surgical protocol, and we are drilling the bone in the right implant position with water killing. And now the yellow drill with 3.5 millimeter. This is a bone level implant, a little bit subcrestal position with a conic connection. And here you see the package of this implant system. We can take easy the implant, and we can insert the implant slowly in the bone bed preparation. We have here very good premier stability with the different macro design of the implant, and with the torque ratchet we bring the implant in the optimum implant position. But with the cover screwing we have the closing of the implant. You see the buccal area that is the last bone through resorption, and this is a case to augmentation the buccal wall which was atrophy, and we use the special screws, micro screws is 1.0 in the diameter with medical steel, and with this we fix the bones in distance to the implants. And normally you need only 2 screws to fix the bone. This is a special holder, screw holder, and now the last millimeter of fixation, and 1 screw is too less because the risk of rotation is big and we need immobility of the bone block. Now you can see the distance between implant and the block. This is very important because we want that the implants always stay in particulate red bone, not with contact with the white cortical bone blocks. This is our philosophy because the nutrition is coming from the particulate bone, and I want to explain later in our biologic principles of bone augmentation why we use this technique. And you see how we are filling the gaps with the bone, particulate bone, which we are winning with the safe scraper through the thinning the blocks, also through the thinning or the rounding the sharp edges from the hair resting area. It's very important that you use very fine instruments to bring in the gaps the particulate bone chips. You need a little bit time because if they are not bone, the soft tissue will graft in, and in this time of the treatment you have make a detailed work and press everywhere the particulate bone. And you can see that the white of the alveolar crest is reconstructed like the original bone without using substitutes, without using biomembranes, non-resorbable or resorbable membranes. We need only 2 screws and 1 safe scraper and the bone from the patient, the autogenous bone, to create pure bone. And when you use gold for your augmentation, you will get bone after the healing time. Our healing time is 4 months, 3 to 4 months, and for a better closing we are cutting the periosteum, and we can mobilize the mucosa flap, and we make our sutures to stabilize the flap, to reduce the mobility for a better healing. Look how long you can push the mucosa flap. This is very important. More is this important if you make a vertical augmentation with monofilament suture 5.0. You can create your closing sutures. You can see also that we are losing the vestibulum. It's in of the case always the same problem that we are reconstructing the soft tissue again in the next operation during the implantation or second stent operation.